Okay, good evening. My name is Stephanie Winters, and I'm here to welcome you on behalf of the American Academy of Pediatrics Vermont chapter. The goal of these forums is to provide factual information on the COVID-19 vaccine in adolescents and really just to have a conversation with families and answer any questions. So we'll be putting a link in the chat box. If you have questions after this forum, feel free to use that link. But for now, please add any questions you have in the chat box and we'll answer them during the question and answer period. Pediatricians and family physicians are privileged to be a trusted source of information around vaccination, and the COVID-19 vaccine is no different. Protecting children and adolescents from vaccine-preventable illnesses is a top priority for primary care practitioners, and they're ready to counsel families on this important decision. So definitely reach out to your pediatrician or your family physician. Some of them are on the call tonight to give you information and answer your questions, so definitely reach out. With that, I will introduce Dr. Steve Soriano, pediatrician at, and I think they just changed their name, Appleseed Pediatrics or Lamoille Health Pediatrics in Morrisville. Dr. Colleen Moran is with us tonight also from that practice, and Dr. Katie Marvin will be joining us shortly, who's a family physician at Lamoille Family Medicine in Stowe. So thank you all for being with us tonight, and with that, I will turn it over to you, Dr. Soriano.
Hi, good evening, everyone. I'm Dr. Soriano. As Stephanie was saying, I'm one of the pediatricians at Lamoille Health Pediatrics, formerly Appleseed Pediatrics. I'm joined tonight by my colleague, Dr. Colleen Moran, and Dr. Katie Marvin from Lamoille Family Medicine. She'll be joining us a little bit later tonight. Oh, there she is. Hi, Katie. All right, so a few slides we're going to go through. So this town hall is all about protecting young Vermonters with COVID vaccines, since we're now able to give these vaccines to people in the 12 to 15 age group. So just objectives for tonight, we're just going to go over through introducing where we are, current state of COVID, reminder about the mental health fallout that we've seen in children and adolescents, video address from AAP Vermont chapter president, Dr. Bell, and information about the vaccine for children. And then after we're done with all of this, we'll go through a brief question and answer session that Dr. Moran, Dr. Marvin, and I will be sitting in on. So first thing is a situation update. I break down by ethnicity and age range. As more and more adults are getting vaccinated and those in the 16 and up age group are getting vaccinated, we're starting to see a shift in the age distribution of those who are getting infected. Now actually the 10 to 19 age group is the second highest group of infections, and first highest is the 20 to 29 group. So as more and more adults are being vaccinated, the infections we are seeing, it's shifting into a younger age range. It's pretty much an even split between male and female who are being infected. Non-Hispanic versus Hispanic age group, 97.2% versus 2.8%. And then breakdown of race, it pretty much mirrors that of Vermont, although there are increased proportion of Vermonters of color who are being infected. The overall cases by week, this is the gray lines are everyone, the orange lines are those in the 14 to the 18 age group, not including college students. So preliminary data here, and showing that still these people in the 14 to 18 age group, which is our area of interest, it's less than the overall population. Overall, we had some spikes in early April in this age group, and it's starting to fall compared to where we were a month ago. And then here's the cases among Vermont school age children based on high school, middle school, and elementary school ages. As you see earlier, just like from that last chart, we had a spike in early April, some decreases since then. So I also want to add here new data coming out that as of this Monday, the CDC was reporting 17,724 new cases of COVID-19. It's actually the lowest number since last June. The 7-day average of hospital admissions over the last week was 3,500, which is an 18% decrease from the 7-day period prior to that. And 7-day average of daily deaths declined to 546 per day, which is actually the lowest number since March 2020 during the first wave of the pandemic. So, I mean, what this shows is is the vaccines are working and they're starting to bring things down. So it's really exciting that they're finally open to the 12 to 18, or sorry, the 12 to 15 age group. So this slide, it really highlights the toll on mental health that the whole pandemic has had. Just going through the voices of young children that they provided with permission. So children and adolescents are saying they feel disconnected from their peers, saying they don't have a true connection, even though they're connected by Zoom and Google Meet and FaceTime. That kids are feeling guilty, relieved, completely terrified when they hear about the health status of other people, and that they've really, this whole generation of kids, they've been forced to grow up fast with all the mental health challenges and all the changes from the pandemic. And the overall statement is that kids just miss being kids and they miss their loved ones. And this highlights the importance of this vaccine getting out to the younger population, teenagers, young adolescents, because this is how we get back to normal. And this is how we get back to being connected and being able to see each other. And here's a message from Dr. Bell, the AAP Vermont chapter president. I'm just going to full screen this so we can play.
Dr. Soriano, I'm not sure if we can hear that. So you may need to unshare. And then when you go back to share, there's a little box in the bottom left-hand corner that says share with sound.
Okay, so let's see.
Sorry about that.
No worries. I have no excuse. I grew up with computers, so I should know better.
So, we forget that.
Oh, there we go.
There's always too many steps. Perfect.
There we go. I'm just going to get this back up here.
Hi there, I'm Becca Bell. I'm a pediatrician in Burlington and the current president of the Vermont chapter of the American Academy of Pediatrics. And I'm just going to take a few moments to talk about how excited we are as pediatricians that the COVID-19 vaccine is available for young people now. So I'm a pediatric intensivist, which means I take care of children in the pediatric intensive care unit at UVM Children's Hospital. And I take care of infants, children, and adolescents who are critically ill or injured. And so vaccines are something that have always been really important to me because they help prevent a lot of the very serious illness I sometimes see in the ICU when children are too young or haven't been vaccinated against a vaccine preventable infection. And when I think back to last spring when everything was shutting down and I was working with some of my other ICU colleagues who care for adults, and we were really worried about the number of ventilators and the number of hospital beds. If you had told me then, a year ago, that we would have a number of safe and effective vaccines that in trials, when tested on tens of thousands of people, prevented people from not just dying, but even becoming seriously ill enough to even be in the hospital, I don't know if I would have believed it. It's amazing how effective these vaccines are. And a lot of people are wondering, how are we able to get these vaccines so quickly? It seems like quite a feat. And, in pediatrics, we're used to vaccines taking a little bit longer. And part of that is that there's a lot of competing interests in terms of what type of research and technology gets funded, right? Lots of competing interests there. And when we test vaccines on other types of infections, usually those infections aren't as common, aren't as prevalent. And so it takes a while to get all that data. But with COVID-19, as we all know, the world stopped last spring, just completely stopped. And the biggest priority that everyone had in the world was stopping this virus. And what that meant really was having safe and effective vaccines. That became the top priority. And so every effort was turned towards that. All this funding was turned towards that. And a ton of collaboration happened in order to make this possible. So I want to talk a little bit about the vaccines that you all qualify for, are eligible for, or will be soon, and that's the messenger RNA vaccine. So that's the Pfizer and Moderna vaccines. So this is a technology that's been in use in cancer therapies, and also scientists have been using it to study vaccines for other infections. And so when the world was told what the SARS-CoV-2 virus looked like, that was something that was shared with everyone, people got to work. And so they used this technology that already existed, and they made it applicable to the SARS-CoV-2 virus. And because there was so much funding going towards this, they were able to make this happen on a little bit of a quicker timeline than usual, but all the steps were there. They went through every single step. And because COVID-19 is so prevalent, when they did the efficacy trials to see if it worked, and they gave vaccine to some people and a placebo to other people, they saw very quickly that the people who received the vaccine weren't getting sick from COVID-19, and the people who didn't receive it were getting sick. And that data was collected so quickly that they were able to get a pretty definitive answer that these vaccines are really effective. And one thing that I think is so interesting about the mRNA vaccine is that it really gives your body instructions for how to make a protein that looks like what's on the virus. So what do I mean by that? So when you get the vaccine, this mRNA is like a little piece of instruction, or I almost think about it like a handwritten recipe that's sort of passed down in your family, right? You have a piece of paper with a recipe, and then these are instructions. Then your cells can make, based on the instructions, can make a spike protein with that. Then once it's made, recipe goes away, and the mRNA, it just kind of disintegrates and disappears. And then what you have is this harmless spike protein that's not the virus, but is similar enough that your immune system can look at it, recognize it, and get ready for it in case they ever see the SARS-CoV-2 virus. And this is really important because this is what will stop the virus from replicating throughout your body if you're exposed to SARS-CoV-2 and making you very sick. And one of the things we know in intensive care medicine is that these viruses, SARS-CoV-2 in particular, the virus itself can cause a problem in your body. It can cause direct injury and illness. But the other problem is on the other end, when your immune system is trying to fight off that virus, that battle that happens can create a ton of inflammation and a lot of problems and a lot of illness. So it's that back and forth between it's the virus and your immune system. When you get exposed to the virus, when you get sick, that can make you really sick. Now, in someone who's been vaccinated, instead, their body sees the virus and their immune system's already ready. They already have the antibodies. They recognize it really quickly before the virus can kind of get out of hand. And they've got the cells ready that they know they need to fight off this virus. And that's why people aren't getting very sick. They're not dying. And if anything, they might have a mild cold after being vaccinated. And that is what's so amazing, is that these vaccines give your cells this recipe for how to create this spike protein. Your body then, your immune system then learns it, understands it, recognizes it, and gets ready for it. So when the first authorization happened, first with Pfizer in December, I was one of the lucky ones to get vaccinated pretty early. And as you can imagine, there were lines of doctors and nurses and other healthcare providers who were just so excited to get this vaccine. I mean, it was emotional. I felt emotional getting the vaccine for the first time, knowing that I was protecting my body. And then I got my second shot in January and had the expected, many people kind of feel crummy the next day because they have that, they can sense their immune system sort of recognizing again this spike protein and sort of revving up for it. And then fine after a day, felt fine after a day. And it's just been so amazing seeing my rest of my family and my friends and my colleagues and everyone I love getting vaccinated. My own children are too young right now. They don't qualify, but I am going to be so relieved and so grateful when the vaccines are approved for their age group, and they will be first in line. So I just wanted to spend a moment just to really let everyone know that, you know, we're living in this really, really challenging time. This virus has really wreaked havoc directly and indirectly, and it's affected all of us. But there is this really bright spot, and that is these vaccines they're really effective, and they're really doing what we want them to do, which is to keep us from getting sick. And we really want you to ask questions. If you have questions about the vaccine, we're here for you. Pediatricians are really excited that the people we love, our patients, are going to get vaccinated soon. And we're happy to walk you and your family through this process and work towards getting our communities healthy and getting back to doing all the stuff that we love doing. So thank you so much for listening, and please feel free to reach out to your pediatrician and reach out to us, and we're happy to work with you on this. Take care. Hi there, I'm Becca.
Right, great message. So why vaccinate your teen? The main reason is, as both of these posters talk about, the main reason is this is how we get back to normal. This is how we let our young teens and preteens go back to meeting kids again and not having to worry about COVID. That being said, there is going to be a lag time where some of us, should be wearing masks while we're waiting for everyone else to be getting vaccinated. But like I said, this vaccine is how we get back to normal, and that's what these posters really underlie. So, COVID vaccines in children. You may have plenty of questions about the vaccines. So the vaccine, the one that was authorized for teens, 16 and up, it was the Pfizer vaccine. And then out of the 3 vaccines that were authorized in late 2020, so the Pfizer vaccine, that's the one that's also recommended for the 12 to 15 age group as of May 12th. As Dr. Bell so eloquently explained how the COVID vaccine works, basically the mRNA goes into your body, tells your body how to make the protein spike that our immune system could recognize the COVID virus from, and then your body has that organized response and knows to look out for that protein, that identifying protein knows how to fight the COVID infection early because it knows what it's looking for. And then after the vaccination, children have less of a chance of getting sick or even transmitting the virus. So the 3 types of vaccines so far are the Pfizer, the Moderna, and the Johnson & Johnson. Moderna is for 18 plus. Pfizer is now 12 plus, so we'll spend more time talking about the Pfizer one. So Pfizer is a 2-dose vaccine, and Johnson & Johnson's the 1 single shot vaccine. This one was temporarily paused due to reports of rare but serious blood clots. FDA later determined that the potential benefits of getting vaccine actually outweighed the risks, and that it was extremely low, the whole risk of developing rare clots. Vaccines themselves are very effective in stopping people from getting COVID-19 and can prevent serious illness, hospitalization, even death in those who do get the vaccine. We don't know how long immunity is going to last from these vaccines. That's going to become more clear in the next months to years. So how do we know that these vaccines are safe for youth? As Dr. Bell was saying, these trials that normally take a long time, we were able to run through them at warp speed because the whole world paused, and scientists, doctors, They were all working on it, from around the world, working together with a single-minded aim of how do we stop this virus. So we were able to run these trials quickly because that was our sole focus, working together. And these vaccines, it's, the CDC has even said, historically, these are some of the most intensive safety monitoring protocols that we've done on these vaccines since they've been introduced. Side effects of the vaccines. So some people are lucky enough they don't have any side effects at all. Most common side effects are the same thing you see in any other vaccine: fevers, chills, headaches, fatigue, nausea, pain in the muscles. On average, these can last one day, sometimes as long as 4 days. And then there's some increase in some of these side effects after the second dose, as many of you may know from your own experiences. Additionally, so it takes 2 weeks after getting the second dose for your body to be immune to the viruses. The Johnson & Johnson vaccine takes about 2 to 4 weeks afterwards. Now, in terms of the vaccine itself, so it's free whether or not you have insurance. And the VDH actually announced too that, for college students, for people who are here temporarily, even if you're not a Vermont resident or temporary resident, the vaccine's gonna be open to those people. So the clinical trial for ages 12 to 15, it showed that the vaccine was both safe and effective. And as of now, their trials started to check on how do we give this vaccine to children as young as 6 months old. So really exciting stuff coming along in the next few months to come. A lot of parents have questions about, is it safe to get other vaccines around the same time? And the answer is yes. You can get your other routine vaccines, within the same time range that you're getting the COVID vaccine. So just because you got your COVID vaccine like last week doesn't mean that your well visit 2 weeks later. I mean, you can still get your regular vaccine 2 weeks later at your well visit. So the best way to sign up for the vaccine is by going to healthvermont.government/myvaccine. And Vermont has partnered with Kinney Drugs, local pharmacies, in the 12 to 15 age group. It's actually going to be a few school-based vaccine clinics where you can sign up. We'll have a link to that in the show notes after this. But both Green Mountain Tech and People's Academy, those are going to be the next school-based vaccine clinics next week on the 26th and 27th, and we'll put this in the link. Oh, and here it is again. So school-related clinics, school-located clinics. Here's a registration for that. If you don't have internet access, you can call 855-722-7878. For those who are under 18, so your parent will have to provide consent over the phone. Some of the school-based clinics too, either there will be a form where parents could fill out consent for the 12 and up group, or just going in as a walk-in with your child. That's the way that you can provide consent for your child to receive the vaccine. And more about the walk-ins, as I was just saying. So you can either sign up over the phone, you can do walk-in. Best way to guarantee that you have a dose is to sign up in advance. So go to those websites, call that number. Let's just go back to that slide for a second. So that's healthvermont.gov/myvaccine, or calling 855-722-7878. Here's some more resources for families, what you need to know about the COVID vaccine, healthy children, some links about mental health tips during the pandemic. And as we're coming out of the pandemic, following up on guidelines, what the latest guidelines and return to normal protocols are going to be. So now we're at the questions and answers section. So I'm going to open the floor to questions and answers, and both Dr. Marvin and Dr. Moran are here with us. So Dr. Moran is my colleague from Lamoille Health Pediatrics, and Dr. Marvin, my colleague from Lamoille Health Family Medicine. Lucky enough to have both of them on here with us.
Great. Thank you so much, Dr. Soriano. That was really, really great, really informative. And I'm so happy that we have so many experts from Lamoille Valley region on with us. So I did add in the chat box the link to the specific list of school or community clinics that you can click on and find one in your area. You're welcome to go to any of them. If you're in a different area for work or whatever, you can travel to different places. So that is in the chat box, as well as a link to a Google form where if you have questions after this happens, after this forum, you can click on that and enter questions at any time. So I'll just read a couple of questions that we have. If no long-term studies have been done on mRNA vaccines, and specifically on children, how do we know these vaccines are safe in regards to long-term side effects? Who wants to take that question? Dr. Marvin, Dr. Soriano, Dr. Moran?
So, I mean, the most important thing to know is that these vaccines are being monitored. You know, and so far in any of the adult studies and the 16 and plus age group, we've seen just routine side effects that we've seen with the other vaccines, like the fevers, joint pains, nausea. You know, and to date, the majority of vaccines that are out there, you know, we don't have any severe long-term effects that weren't identified within the short-term period after these vaccines were introduced.
Great. And can you clarify the mRNA technology is not a new technology, correct?
No. So this is technology that's been around for decades. If anyone remembers SARS, what was that 20 years ago now? I mean, that was one of the first times this technology was starting to be developed. So it's not like this technology came out of nowhere. We've had it lying around for decades, and now we figured out it works for COVID. So so this technology isn't new. It's been studied for decades now.
Great. If your child is in between doses for another vaccine, for example, Gardasil dose 1 and 2, is it safe to get the Pfizer vaccine if it's been more than 2 weeks? How long should you wait after Pfizer dose 2 to receive a second dose of the other vaccine?
So you don't need to wait at any time. So your routine vaccines, you don't need to wait, or it doesn't affect, you know, if you got the COVID vaccines or not, it doesn't affect the routine administration of other vaccines. So you could go ahead and get your vaccines as you normally would.
Great. Are the side effects of vaccination for children likely to follow the same course of side effects that their parents had?
Yes.
Great. Are there any issues with the volume of the vaccine dose for smaller children, such as those under 70 pounds?
So no, the volume isn't different for children or adults. And to give an example of another widely used vaccine, for example, the flu vaccine that we all get every fall, it's the same volume whether you're 3 or 65. It's only 36 months and under where you have a smaller volume of the dose. So so the volume doesn't, at this stage, 12 and up, the volume's the same. There's a lot of research to come in the next few months, since we're going to be doing studies that go down to the 6-month age range. And I can't say now what the volume's going to be for a 6-month-old, but at least for the 12 and up, volume's the same between whether you're 12 or 70.
Great. And then a question has come in about, sorry, I just lost my, about boosters. Do you think that there will need to be boosters for these, like the flu shot, or more like other vaccines?
So this time it's too early to tell. So far, everyone who got vaccinated, I mean, these vaccines are only, it's been about 6 months since these vaccines have been out. We'll have to monitor. We'll have to monitor over the next few months and years. So sorry to cop out.
Are there any
still waiting on research on that one.
No, yeah. I mean, I think a lot of this is a wait and see how often or how how long you can go between boosters. That's science, right? We keep learning every day. Are there any contraindications to getting vaccinated, such as allergies or asthma?
So the only 2 contraindications right now are having had a reaction to any of the vaccine components. So so basically, if you've been fine for your other vaccines, then you're fine for this one. allergies and so I just want to say allergies and asthma are not contraindications. In fact, if you have asthma, it's probably better to get a vaccine to a virus that can have respiratory effects.
Great. Well, I don't have any more questions that have come in. I wonder if Dr. Marvin or Dr. Moran want to add anything, and then if you want to give some final thoughts, perhaps we could talk a little bit about how many 12 to 15-year-olds have been vaccinated in the United States. The number came out today, and it was pretty astounding. I don't know if you want to comment on that, Dr. Soriano?
Yeah, so actually 600,000 12 to 15-year-olds have been vaccinated since the vaccine came out. So this is really exciting.
I just wanted to say I'm actually at the Lamoille Tech Center right now. and so before our game today, I coach up here, as you probably know, but I wandered through and said hi to a ton of people that we know and a ton of patients that were there getting vaccinated. And then about half my team, played with Band-Aids on their arms. So they went right from getting the shot to playing pretty competitive sports. There was a baseball, softball, and 2 lacrosse games tonight. So that might explain where some parents are, supporting their kids in those sports. But I was psyched to see that there was a lot of enthusiasm among the players and among the students here to get vaccinated, and then reassure their friends that it went fine and it didn't hurt that much and that it wasn't that big a deal and that they feel fine afterwards. And they did, I think, 290 shots this afternoon here. So a lot of students and their parents were coming through. It was a busy place to be today with everything going on.
That's great. And I think that's been a common theme that I've heard, that actually the adolescents really want the vaccine. The parents are nervous, but the adolescents are ready to get back to normal and to get the vaccine, and they want to take that step. So it's encouraging.
Yeah, I mean, similarly, I had my 12-year-old vaccinated last Friday, I think, and she was psyched. She doesn't like shots at all. She wanted to be there. She really wants to be able to go to, a soccer camp this summer and maybe not have to wear her mask. And just, traveling to see my parents who are older, just to make sure that if there's any chance that the vaccine wanes over time, that she is safe, doesn't in any way bring a virus into their home. And so I think that the students have been through so much this year. This is a year unlike any we experienced as teenagers, and they are resilient and they're doing their best, but they are ready to be back to normal. They all are, even kids that never wanted to be in school are begging to go back to school. And so I'm seeing so much of a push from the teens to get this done. It's really encouraging. And I've had some actually really mature questions from teenagers on televisits this week, asking extremely great questions themselves without any prompting from anyone else, and doing their research and then sort of saying, okay, that sounds really reasonable. Thanks for asking questions. I think I'm going to go get my shot tomorrow. And then in this area, I'll put a plug in. So the Green Mountain Tech Center has, as we know, been doing these clinics as they did today, but also, CVS for sure has had a lot of walk-in availability locally. And also I believe Kenny's are the big ones locally here in Lamoille County. It's like teen day at Great. CVS.
Wonderful. Thank you. Dr. Moran, did you want to add anything?
Sure. Thanks, Stephanie, and thanks for arranging these. I know that they've been really important across the state, and I'm thrilled to hear that they're being recorded as well, because I think it's important for us to be able to keep offering these resources. I find the conversation that I'm continuing to have is that just to keep answering the questions, and that's why we are all here as part of your medical home. So for families that have questions or concerns or want to clarify anything, that's why we're here, and give us a call and we can help get you connected to resources and answer your questions. Similar to, as Dr. Marvin just mentioned, that, I think it's been incredibly emotional for all of us from a personal level to a professional level. And my own 12-year-old got her first COVID vaccine for her 12th birthday. And, the younger family members can't wait until it's available to them as well. And so I think it's a true testament to what happens when we all collaborate together and can create and focus on how do we best support everybody. So again, I think just as the theme keeps being spread around, that we absolutely want you to ask questions, and we'll give you all the information that we have so that everybody can make informed decisions and get back to all those things that we love doing and seeing everybody's beautiful smiles.
That's great. Thank you so much. And again, I think that's what the hope of these forums is to really bring information, answer questions, and make people feel better about the science and the future and what this will bring us. And so I think that was our hope in bringing this information to you. For me, educating myself it makes me feel better. It gives me an ease of mind. And so I just hope that that's what this does for you. And again, if you have questions, no matter what they are, ask your medical home, ask your primary care practitioner, your family physician, your pediatrician. They want to hear from you, and they want to help you make these important decisions for you and your family. So with that, I will close out the session. I want to thank our three clinicians, our Dr. Soriano, Dr. Marvin, and Dr. Moran. Thank you so much for being with us and sharing your expertise, even from the ball field. And we so appreciate your time, and thank you for being with us. Good night, everyone.